Hi there, my name is Dr. Virginia Hatch-Pigott, and this is a re-recording of my presentation to the Grand Canyon University Behavioral Health Conference, April 2023. And I'm absolutely thrilled that you're joining me because I am so excited to present to you QEEG brain mapping and neurofeedback. So let me go ahead and share my screen. I can figure out how to do it on here. There we go. Okay. The title of this presentation is Expanding the Bio and the Biopsychosocial Model of Human Flourishing, QEEG Brain Mapping and Neurofeedback for the Behavioral Health Practitioner. So I'm going to start with a brief introduction and then review brain basics, because I feel like we all kind of need to go over that from time to time. Review brain evaluation, brain dysfunction, and then try and spend the meat of this talk on QEEG guided neurofeedback. So by way of introduction, again, I am Dr. Virginia Hatch-Pigott. I'm a general pediatrician. I have 25 years of experience in rural areas, in big cities, in big hospitals, small group practice, private practice. And what I noticed over my career, especially the last 10 years, was the mental health of my patient population declining. And I had little access to referring my patients out for help. Especially, I thought the big cities would be better, but the population is bigger. And while there might be more child psychiatrists and psychologists, they are as overwhelmed as the psychologists and psychiatrists and LCSWs and therapists, LPCs in the more rural areas. So I had to learn psychiatric medication management on my own. Obviously, I had some training in that, but I had to get a lot better. And also felt like I was doing counseling on the side. When COVID hit, I decided to take a deep dive into mental health. I had read the book, The Body Keeps the Score. I have a special interest in foster care and adoption. And by the end of that book, I realized I wanted to learn two modalities, EMDR and neurofeedback, which I did during my MSW at GCU. And it was a great experience. And I am just thrilled to present to you what I have learned about neurofeedback. So this is the biopsychosocial model. So this should be familiar to a lot of you. It was proposed by George Engel in 1977, and he was an internist and a psychiatrist who understood that human illness was much more complex than just, well, let's look for the source of the pain and cut it out or give it some medication. For example, in my own experience, I oftentimes have children that come to me with abdominal pain. And I will look for the number one cause in pediatrics, and that is constipation. And when they don't have that, of course, I will look for celiac disease, parasites, bacteria. I can send them to the pediatric gastroenterologist, and he can scope them from the top and the bottom and do biopsies. And I would say a good 50% of the time in this day and age, everything comes back normal. And as we know, from the mental health side, oftentimes these children just have generalized anxiety disorder or are experiencing a lot of stress at home or at school. And when you're in fight or flight, of course, and we're going to review this, not only does your heart rate and your respiratory rate go up, but your gut shuts down, and you're left with nausea and pain. It doesn't feel good to eat and then have things not move forward. So the biopsychosocial theory, as you can see here, says that mental health is really a conglomerate of the biological aspect, the psychological aspect, and the social aspect. And I know that most mental health practitioners know this. Family circumstances, peers, school, family relationships are the social aspect and really impact mental health. Psychological aspect, meaning coping skills and social skills and self-esteem. And we also know that physical health has a huge impact on mental health. And George Engel, therefore, was a pioneer in medicine for his holistic approach for caring for humans. Unfortunately, I feel like medicine continues to struggle to integrate this framework into practice, but psychology and social work have done a much better job. However, while psychology and social work tip their hats to the bio aspect of our clients, we continue to largely ignore this aspect. It's our weakest link, so to speak. Allied mental health practitioners, unfortunately, however, it's not really our fault. We just don't have access to lab tests and genetic testing and SPECT scans and fMRIs and other kinds of modalities. But thankfully, I'm introducing you today to something that medicine, unfortunately, has largely ignored, but happily, a small but growing number of social workers and psychologists have championed. And this modality, if you choose to pursue this, which I really encourage you to, will expand the biodiagnostic and treatment capabilities beyond your wildest imagination. So I want to highlight something really quickly here because this is important. Mental illness is largely inherited. The medical community has long reported on the heritability of mental illness, a prominent risk factor for our patients functioning socially and in society. In fact, most psychiatric disorders are genetically inherited, including intellectual disability, alcohol dependence, schizophrenia, bipolar disorder, ADHD, autism spectrum disorder, major depressive disorder, obsessive compulsive disorder, and anorexia nervosa. One of the most impactful recent advances in neuroscience is that of epigenetics, or the turning off or on of genes that might confer resilience or fragility. That I could go on and on about that, but we'll leave that for another talk. Let's talk about brain basics. So the nervous system is the command center of the body and is active every second of every day of our lives. It's made up of the central nervous system, the brain, the brainstem, and spinal cord, and then the peripheral nervous system, 12 pairs of cranial nerves and 31 pairs of spinal nerves. The brain is not only the most complex organ in the body, but is truly the most intricate communication system in the known universe. It is about the size of 2 clenched fists and weighs about 3 pounds or 2% of your body weight, depending on how lean you are. But it uses 20% of the oxygen and energy that you consume. That's in the resting state. The peripheral nervous system is further divided into the somatic or voluntary nervous system and the autonomic or involuntary nervous system. And then the autonomic nervous system then is further broken down into the sympathetic or activating nervous system and the parasympathetic or deactivating nervous system. And so when we practice DBT, which a lot of us do, we are teaching people to activate the parasympathetic nervous system. So things like box breathing, and just belly breathing and yawning and stretching, swinging, all of these things that we teach people to self-soothe are activating of the peripheral nervous system, or I'm sorry, the parasympathetic nervous system. So we'll just really briefly go over this. When you're in fight or flight, of course, the brain sends a signal. It detects a threat like an angry person coming towards them or a rattlesnake. It doesn't matter what it is. A signal gets sent down the vagus nerve and activates the sympathetic nervous system. Pupils dilate, blood vessels constrict, airways relax, respiratory rate goes up and becomes shallow, heartbeat accelerates, sweat is stimulated in our sweat glands. And of course, like we mentioned before, it inhibits digestion. So this is all meant to shunt blood away from organs like the skin and the GI tract that are not needed to escape a threat, and shunt it to the muscles and heart so that you can save yourself. And then when the parasympathetic division is activated, there is the opposite. The pupils constrict, salivation is stimulated, airways actually constrict, the heart rate goes down, and it stimulates digestion. So we oftentimes will call this fight or flight and rest and digest. And we are working with the nervous system when we are doing, when we are teaching our patients or our clients self-calming techniques. So let's take a little deeper dive. The brain contains about 86 to 100 billion brain cells and even more glial cells. Neurons are the cells that transmit information to, from, and within the brain. And glial cells, which glia means glue, they make up the supporting system. And as we learn more and more about the brain, it really is the last frontier in medicine. It may be more fair to call the glia supporting cast members and the neurons the main cast members. So we think that maybe the glia do more than just glue everything together. So the brain is an electrochemical organ. In other words, it communicates signals to and from the brain to the body, and from the body to the brain via electricity. There are also chemicals, many of which you have heard about, like adrenaline, noradrenaline, serotonin, dopamine, GABA, and others. Electricity is generated by ions or charged molecules in and around our cells. In the resting state, the concentration of sodium outside the cell is higher than the concentration inside the cell, and the concentration of potassium inside the cell is higher than that outside the cell. So when a neuron receives a message or a signal from another neuron, it opens voltage-gated sodium channels, and sodium rushes in across the cell membrane. The more sodium that flows in, the more channels are opened, and this creates a current across the cell membrane. And once a certain threshold has been met, it creates an action potential that excites the adjacent membrane, opening channels as the electrical impulse then travels down the axon, this long portion right here, to the dendrites and the synaptic junction, where then neurotransmitters are released. So this is really important for understanding why neurofeedback is so powerful. The synaptic junction is where medications, so we see right here in the synaptic cleft, this is where medications target the problem that we're dealing with in our clients or our patients. So what most physicians might say is, well, you know, maybe you just didn't inherit enough serotonin, and so we're going to give you a SSRI so that when the serotonin is released, it's a reuptake inhibitor. It hangs out in the synaptic cleft a little bit longer, and hopefully will open more of these ion-gated channels in the next membrane, and then everything is sped up. But neurofeedback specialists, on the other hand, believe that we have plenty of serotonin or dopamine or whatever we're treating. And we believe the problem is in the electricity. So imagine over here, so you see that it's how the nervous system communicates is electrical, chemical, electrical. So it goes zap, opens the synaptic junctions, zap, 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 all at lightning speed. But what neurotherapists believe is that it's not really that you don't have enough serotonin or dopamine or whatever the medication is targeting. The real problem is in the electricity. And if we can train you to change your electricity, you will have plenty of neurotransmitter in the synaptic junction. So what if you have a really weak spark in a certain area of your brain? You're not going to release enough neurotransmitter. If you have a really strong spark, you're going to release too much. So let's just talk about brain waves for a minute. Along the bottom here, you can see these are second lines. And there are 5 basic types of brain waves. 90% are between delta and beta, and this is what we train. So delta waves are up here at the top. It's 0 to 4 waves per second, or we say cycles per second, or hertz. So 0 to 4 hertz. That is deep sleep or coma. Theta waves are 4 to 8 waves per second, and that is 4 to 8 hertz, and that is drowsiness. Alpha waves are 8 to 12 or 13 hertz. You can count the waves here in the 1 second. Alpha waves are associated with awake and alert state, not engaged in anything, but maybe just daydreaming and relaxed. And then beta waves here are 13 to 32 hertz. And that's associated with active learning, working through a math problem. If you're an athlete, it's, say you're a soccer goalie, the team is coming towards you and you're plotting out how you're going to block that shot on the goal. And so you would be in beta. This is what an EEG actually looks like. You're not all in alpha or all in beta. The brain is really a symphony. And this is a 19-channel EEG. And as expected, there's a lot going on in different parts of the brain at any given time. So I'm going to take a little side note here. There are 2 types of imaging before we get into QEEG brain mapping. There are structural and functional. So X-rays, CAT scans, and MRIs are structural. So they show structures like bone and brain tissue and fluid and air and blood. So it would tell you if somebody was in a motor vehicle accident, if you had a cracked skull. CT scans we use a lot in patients also who have been in motor vehicle accidents to see if they have a subdural hematoma or a brain bleed. They're also quick for stroke, or to see if somebody's herniating, if their brainstem is going down into their spinal cord. We use MRIs a lot to look not just for trauma, but past traumas, genetic brain structural abnormalities, tumors, also strokes. But they don't tell us how a brain is functioning. So, and it might look like a fantastic brain, but the person could be struggling with, say, schizophrenia. It just shows you structures. So PET scans and SPECT scans, on the other hand, are functional forms of neuroimaging. The picture on the right is from the Amen clinics. They're absolutely beautiful, colorful pictures. The one on the left is a healthy brain, and the one on the right is a drug-affected individual. And you can see that they have, the individual has really ravaged their brain. So you can see it almost looks like Swiss cheese, and those are areas where there is no blood flow. So PET scans and SPECT scans will relate to blood flow. And if you can see on the left, lower here, the frontal lobes, those pink, that should be pink and hot. This is where the frontal lobes are where you do most of your executive function. And you can see here, especially underneath, it's not quite as much, but then there's these holes here. This is a study that was using Dr. Amon's work in SPECT imaging. And this is an 18-year-old who was a daily user of marijuana for several years. So SPECT scans are extremely useful for research. They're also very useful for, just take the guesswork, as Dr. Amon says, that takes the guesswork out of psychiatry. We can really pinpoint what's going on. As we know, there's a lot of overlap in psychiatric symptoms. And sometimes, is it stress that's causing the attention problems? Is it ADHD? Is it severe anxiety in children? It's hard to tell, if somebody has severe anxiety or OCD that may be causing their attention problems, or is it ADHD, or is it both? So it takes the guesswork out and helps people address the problems directly. This is the form of functional neuroimaging that I'm going to spend the meat of my talk on. This is a QEEG brain map. So remember the EEG that I showed you? What we do is we take the amplitude and the frequency of the brain waves at each of the 19 sites, and it gets quantified and compared to normals. On the right, you can see up here is standard deviations. So we take an individual's brain map. We collect a 19-channel EEG. There's no needles involved. That's one benefit of QEEG brain mapping. Another benefit is that it's accessible, and psychologists and LCSWs, RNs, occupational therapists can all become trained in neurofeedback and utilize it in their practice. So no needles, and accessible to multiple practitioners. The amplitude, so back to the brain map, the amplitude and the frequency of the brain waves at each site is quantified and compared to age-matched controls. And then it's compiled into data sets, or like Excel spreadsheets, but that's really hard for somebody to look at and go, wow, okay, well, you're 2 standard deviations away from the mean at FZ at this site. How does that look? So basically what a QEEG brain map is a color map. So it maps in standard deviations where an individual's electricity is off. And this is important. This relates to SPECT imaging. So there's a lot of overlap here. SPECT imaging shows blood flow, where there's blood flow, where there's too much, where there's too little. Well, we know that delta, theta, and alpha are associated with decreased blood flow, and beta is associated with increased blood flow. So it's very similar. And we can see this is a study that Bob Gurney, who is my boss and the director at the Scottsdale Neurofeedback Institute, did several years ago, subtypes of generalized anxiety disorder. So if you're 0 standard deviations away from the mean, it's all going to be black. It's going to look normal. 61% of the clients he screened had this excess beta all over. So that was one subtype of anxiety. These individuals also struggled with insomnia and alcohol or drug abuse, because, of course, beta would be a racing brain. These individuals, and this is the group average for alcoholics, is excess beta all over. And we've said it in a million different ways, but they're just, and here's the proof. So I think this is also very empowering for our clients. And we can say, hey, here's why you're so driven to drink or take Xanax or benzos, because your brain is racing. And what we find is that if we can train that away, you won't be so driven to drink. And we understand why having a racing brain is probably very exhausting. 55% of the clients had this high alpha subtype all over. Another subset had low alpha, not enough alpha. 71% actually had this, see this red stripe here? This is excess theta in the cingulate gyrus. That is associated with OCD or obsessing, ruminating. You could also have a high mean frequency of beta, like this person did right over the center, and a high mean frequency of alpha. So this is another really big benefit of QEEG brain mapping, is that we can see exactly where the problem is and treat it where the problem is. So we can treat right down to about the size of a quarter instead of medications. And we have a lot of patients that come in here that are having too many side effects from their medications, or just don't want to take medications, or medications were working and they stopped working for themselves. So we get a wide variety, and some patients come in and they just want to know what medications will work for them. And we know that if you have the alpha subtype, and I'll hold off on telling you that because I'm going to get to that here. I do want to review the fact that mental health is a huge, huge issue. I think we all know this. The mental health in my patient population of the children and adolescents has been declining for some time. And we know that dysfunctional brains make dysfunctional decisions, and it's one of the primary drivers of everything that we care about: academic failure, the ability to meaningfully support oneself after they turn 18, the ability to maintain relationships, substance use, poverty, homelessness, incarceration. But the general population struggles as well. About 20% of the adult population and 25% of teens struggle with anxiety. Over 10% of children and 4% of adults have ADHD. Over half the children with ADHD have at least one other comorbid mental or behavioral health diagnosis. And mental health costs before the pandemic were $225 million, up 52% over the previous decade. And I want to clarify something here. I'm a Christian, and I believe that you are not your brain, that your identity lies in the fact that you're an image bearer of a holy God. And if you are not spiritual, I would point you to the work of Dr. Jeffrey Schwartz, who has written extensively about the fact that the mind is separate from the brain. So when we're dealing with mental illness or brain dysfunction, I'm always careful to stress that point with my clients. Don't label yourself. You have a brain-based disorder. You are not that disorder. And I believe that to be able to show people functional brain imaging like a SPECT scan or a QEEG brain map is extremely empowering. It shows people why they're struggling, and they're not fighting themselves. They're fighting for their brain health. ADHD is on the rise in children in the United States. They were 6.1% in 1997, and now it's over 10%. And this is the breakdown based on ethnicity. I think some of the disparity here might be in access to healthcare and cultural reasons for admitting mental health. And again, if we can destigmatize mental health issues and show people that, hey, this is a brain dysfunction, just like your liver can be dysfunctional or your pancreas can be dysfunctional and develop diabetes, you know, your brain is just another organ, and it can have problems too. And it's not your fault. A lot of it is inherited. So what is neurofeedback? In simplest terms, it's physical therapy for the brain. So psychotherapy, which is extremely important, it enriches the mind. Neurofeedback enriches the brain. A psychotherapist gathers data about thoughts and emotions and provides feedback via empathic reflection, clarification, and it challenges cognitive distortions and encourages new behavioral responses. Similarly, EEG gathers data about the functioning of the brain and provides feedback in various forms to the client, informing the client in real time of where it may be producing too much or too little of a selected frequency range, challenging it to change and encouraging it through the progress being made. I'm going to take a little, some people are like, well, how in the world does that work? So I'm going to tell you about Barry Sturman. Neurofeedback owes a great deal of its origins to this man. He earned his PhD in psychology and neuroscience in 1963 from UCLA, and he continued working there and was interested in studying the electrical activity of the brain. According to the director of Scottsdale Neurofeedback, Bob Gurney, who has known Dr. Sturman professionally for many years, he was told that he was studying sleep spindles in cats when one of his colleagues lost funding and they had to shut down the lab at night. Of course, he was very frustrated, and the thought occurred to him that he might be able to train the cats to make the sleep spindles during the day. And his next thought immediately was like, wait, everybody knows you can't change brain waves, and even if you could, they would go right back. And unfortunately, that is still what a lot of the medical profession believes. He apparently was a true skeptic and decided to research the data because he was thinking, how in the world would anybody know that? Who would have done that research? So he decided to check the sources and the sources of the sources and the sources of those sources. And he found out that some German neurologist decades ago just made the statement. And after that, it got baked into our scientific research. People were just claiming it because somebody claimed it. And unfortunately, like I said, a lot of people still believe that. So he decided to do the study that would either confirm or deny that theory. And he spoke to all his cat researcher buddies and found out that chicken broth mixed with milk was the most potent reward for a cat. And he conducted a Pavlovian style experiment with 10 cats where they pressed a lever to receive 6 drops of chicken broth mixed with milk. Then he introduced a tone with the lever. And so the cats were able to press the lever after the tone stopped. And what he noticed as these cats were hooked up is that they were producing a rhythm that we call SMR, which is sort of between alpha and beta. So he decided to alter the experiment. He removed the tone and rewarded them for making SMR. And the bigger the SMR, the greater their reward. And to his surprise, the cats started making huge SMR waves, and they got bigger and bigger and bigger. Interestingly, their theta waves also went down. Remember, those are the drowsy waves. The drowsy waves were going down. He decided he didn't want really huge, big SMR waves, and maybe he would get longer stretches. Let's just try and train them to make longer stretches. And they did that. So pretty soon they were making these huge, long stretches of these SMR waves. And of course, he got his paper. And he proved that brain waves can be changed. Mammals could train to change their own brain waves. 8 months later, NASA contacted him because astronauts were having seizures. And they were fairly certain that the seizures were from exposure to rocket fuel, but they wanted him to do an experiment to substantiate their hunch. He hooked up 30 cats this time, and 10 were in the previous experiment with the SMR waves. And to his surprise, when he hooked those 10 cats back up, they were making still these huge long stretches of SMR exactly where he left them off. So another huge discovery that you can change brain waves, and when you change them, they stick. Even more fortuitous was the fact that when he exposed these cats to the rocket fuel, they all seized except those cats. And of course, he was floored by this discovery. Why were these cats not having seizures? Of course, he marched over to the Department of Neurology and recruited patients who were drug resistant, the epileptic patients who were drug resistant, and did a study. And guess what? He trained their SMR up and their slow waves down, and they became seizure free. And apparently, reportedly, from Bob Gurney said that his grad students didn't believe it, and so they trained the patients back the way they were, and their seizures came back. And so they trained them back down, and their seizures largely abated or went away. And so the why this isn't used for all of our seizure patients is beyond me at this point, since that was 50 years ago. But today, neurofeedback is evidence-based, level 5. You can't get any higher than that for the treatment of ADHD. It's endorsed by the American Academy of Pediatrics for the treatment of ADHD, shown to be as efficacious as medications and behavioral modification. And other research is ongoing for depression, anxiety, OCD, schizophrenia, autism. It's the list just goes on and on. This is a study that was published back in 1988, and this is the group average for depression. I want to just show you this, different mental health disorders. So, of course, after they got all their normals, this is the New York University database, and they were the very first to have a database for quote normals, people that weren't struggling with anxiety or depression or learning disabilities or autism or anything. And then their next project, of course, was, okay, now we know normals are normal. They had to get new normals to run through, okay, our normal's normal, which they did. And to date, 38 countries have run their normals through the New York University database. And guess what? It doesn't matter if you speak Chinese or Swahili, a brain is a brain. So they're all run through and just look spot on normal, just like this top row here. So anyways, the New York University, then they said, okay, well, we're assuming that abnormal brains are going to look different. And so this was the group average for unipolar depression was excess alpha over the center. And apparently the maker of Prozac borrowed this, and Prozac works in about 30% of patients. And when they used this though, and saw that they had the central alpha subtype of depression, that it works 70% of the time. It blows all other factors out of the water. So very helpful for medication. This is bipolar depression. This is, as we spoke about earlier, severe anxiety and alcoholism, the group average, excess beta all over. There really are no medications that work for that other than benzodiazepines, which are highly addictive. So neurofeedback is a particularly potent and reasonable and good treatment for individuals with excess beta all over. This is schizophrenia, excess theta all over, also mild cognitive impairment, and then dementia. Now we have excess delta. Okay, so go ahead here. This is an example of a more updated NYU database. It is called NX-Link on the top, and the bottom 2 rows are brain maps from a different beta. Down here, these lower 2, that's from a different database, Neurorep. And this is also, I think we looked at this earlier. So the different subtypes of anxiety in the NX-Link and the Neurorep. Neurorep is from the University of Maryland. Here are the different subtypes of ADHD. This is really interesting. Bob Gurney did this research probably 30 years ago. And he found 5 different subtypes of ADHD. And this really highlights the importance of QEEG brain mapping and why some medications work well and other for our clients and other medications don't. So there is also why really we should be using QEEG brain mapping and not just winging it with our neurofeedback. There are in the past places that would just use standard protocols, probably still some today, but this really highlights why we shouldn't do just standard protocols, and we should get a brain map on all of our clients. So this is the excess theta subtype of ADHD. So there's excess theta waves in the frontal lobes. This individual has excess alpha in the frontal lobes, and this individual has excess beta. So too much or too little of anything in the frontal lobes is not good. You can also have a normal map. This is very interesting, and I think maybe Bob Gurney is one of the few people that does this test. But we, in our assessment phase, we hook people up over the frontal lobes and have them do one of our tests, the TOVA test, while they're hooked up to see what happens with their brainwaves while they're engaged in a task that is not particularly engaging but long. And ADHD is a failure to be able to persist in a task over a sustained period of time. And what we see in individuals with ADHD, even if they have a normal brain map but have ADHD, is that their slow waves rise with a task, which means the blood is draining from their frontal lobes, which is why they check out after 1 or 2 paragraphs or 1 or 2 words. So this is some objective testing before and after. This is the IVA test, the continuous performance test, and this is their attention. This individual's attention quotient should be commensurate with their IQ. You can see it's a 58 here, and after 40 sessions of neurofeedback, it went to a 105. The IVA also breaks it down into auditory and visual attention. So went from a 54 to a 103 and from a 70 to a 107. And the response control, meaning how quickly they responded and consistently, the response control went from a 47 to a 123. It's dramatic. Auditory stimulus from a 45 to a 121 and from a 65 to a 119. So we like to do a formal assessment and do some objective testing so we can follow our clients over time to make sure that the training, the brainwave training that we're doing is actually working for the client. And now I'm going to show you a couple of video clips, if I can here. Let's see, just so that you can get an idea of, what it looks like. Sorry about this. Let's see. Should have had this set up before. Whoop. Oh, I'm going to have to cut and paste here. Okay, so this individual is doing eyes open training. He's got a cap. We use gel caps. You can see the thermometer there. You could do neurofeedback just looking at the thermometer. This individual is training theta down. And when the thermometer is going up, his screen is dimming. So this is a much better and engaging, especially for children, to watch a movie on Netflix or Disney Plus. And so his feedback is a bright screen. So his brain is being rewarded when the screen is bright, and you can see it goes dark when he's making too much theta. There it comes bright. His theta is going down and going dark. Okay, and then we'll watch this other one. So I'm going to show you eyes closed training. So we do training in eyes open and eyes closed. About 60% of the time, it's different. Your EEG and eyes open versus eyes closed. So this individual is, oh, I think this is the, oh no. This is SW Loretta. I didn't want to show you this one. We do, well, maybe that's what we're going to watch. So this is SW Loretta. This is 19 channel training. I'll just show you this since we're here. So his feedback is getting that green dot, and there's a base that's going in that. So SW Loretta is a deeper brain training. It's training phase and coherence, which is basically connectivity and timing in the brain, as well as the power. Okay, I would be happy. Let me just show you my references if you would like to copy any of that down. Lots of information. Encourage you to go to the bcia.org website where you can find information about getting formal training and certification in neurofeedback. Another website I would refer you to is ISNR, which is the International Society for Neuroregulation and Research. Lots of good data and references on there. All right, thank you so much. If you have any questions, please feel free to reach out to me on LinkedIn or here at Scottsdale Neurofeedback Institute, or my email, GinnyPigMD@yahoo.com, GinniPigMD@yahoo.com. Thanks so much.